Okay, so we got an order to remove this NG tube. So what am I gonna do to remove the NG tube? So first of all, what I probably would do is I put my gloves on, I probably turn this NG to suction off for a little bit. Usually that's what we do, is we turn it off for a little bit as a trial before we actually take it out to see how he's tolerating it. So let's say this is off, okay? Let's take this off. And we have just kind of capped. So of course when you do that, put your gloves on. Okay, so it's capped. So I come in, I have my order to remove the DCD-NG. So it's been sitting off for a while. First thing I would want to do before I take it off is to make sure it's a good order. So I'm going to do some assessments, right? So make sure that before I take it out and have to put it back in, I'm going to do some assessments. So I would check his abdomen. So what does his abdomen look like? Hopefully it's not distended anymore. Hopefully it's not. So I look at his abdomen, let's say it's flat. So then I'm gonna listen, I'll take my stethoscope, put it in my ears, and listen, have him lean back, so usually they're at 30 degrees, they're flat when I'm listening. So, oh, he's got good bowel sounds now. Gurgle, 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 gurgle. Now sometimes we actually do take it out when they don't have bowel sounds. It's after they come back from surgery, we may take it out before the bowel sounds are back. But that's a different story than somebody who has a small bowel obstruction. You usually wait till the bowel sounds return. So we gotta know what we're looking for. So the bowel sounds are there. So he's got soft, it's flat, good bowel sounds. I feel it's soft. He's no longer nauseous when I turned it off. He had been putting out a smaller and a smaller amount too. So, he looks like he's ready to have that out. So I said, sir, I think we're gonna be able to get that NG out for you today. Oh, he's thrilled to death. He doesn't like that thing in. So it's good practice to make sure you're doing an assessment first. It's also good practice to go ahead and verify placement. So you can do it several ways. You can check to see, the pH, the color. You can just do the measurement. So it's a good thing to. And why do we do that? I know we're going to be taking it out. It's just to say, yeah, when I took it out, it was in place. So maybe I'll measure it. Maybe I'll do the pull up, get some pH, check the pH. But let's say I've done that. So what would I need to do next? So I want to, could be some leftover suction in this tube. Now remember when you look at that tube, that if I pull this out and I've got stuff in here, what is this? This is acidic. And as I'm pulling out and the stuff is coming out, what can happen to that stuff that's inside the tube if there's stuff in there? It can drip out as I'm pulling it out. So I want that stuff out of there. I don't want it to drip out and drip into the esophagus. I don't want it to drip out and drip inside. Gosh, see, he takes a deep breath and it drips into the lungs. So I want to get the stuff that's in the inside of the tube cleared out. So I'm going to go ahead, and I've already checked my placement. I'm going to go ahead and your book says to flush it with saline, or you can flush it with air. Now, obviously, if I flush it with saline, remember when you put anything in, water, saline, food, whatever you're putting in, you must check placement. So make sure you do a good placement check. I'm going to go ahead and flush it with air. I like flushing it with air, a good 30 cc's of air to clear the line. So I flushed it with air, and I can just keep this on. I'm trying to prevent anything in the tube from coming back out when it's dripping out, whatever it is, so it doesn't irritate, whether it's saline or what. The saline won't go into the lungs, all that stuff. So I'm trying to flush that out so it's not acid that goes into the lungs. So that's my whole point. When I take it out, I'm trying to prevent anything from getting into the lungs and aspirating. So I've cleaned the stuff on the inside from the acid, but there's still stuff on the outside of the tube. So what can I do to prevent him from aspirating that? Well, I want you to take a deep breath right now. Now try and take another breath while you're holding your breath. So take a deep breath and hold it, and try and take another one. You can't, right? So if you take a deep breath and hold it, you can't breathe anymore. So that's what I'll have the patient do, is take a deep breath and hold it. While he's holding it, I'm going to quickly pull it out. So I'm going to take my towel and lay it lengthwise. And I'm going to take this tape off. I don't have to worry about unwrapping it all, just because I'm just going to pull it out from the nose. Now, when I'm ready, sir, one of the things is to prevent it from getting into your lungs is I'm going to have you take a deep breath and hold it. I've already cleaned it out from the inside. Now I'm going to have a deep breath and hold, because I want to prevent it from aspirating. So, sir, on the count of 3, I want you to take a deep breath and hold, and then I'm going to pull this tube out. Make sure you loosen it around the nose so it's not stuck. Okay. 1, 2, 3. Take a deep breath. While he's holding it, I'm pulling it out hand over hand over hand, and then I'm going to put it in my little towel or my, okay, it's all out. And I'm going to put it in my towel or my chucks and dispose of it properly where it needs to go. I'm going to record my I's and O's and how much was actually in the container there. Sir, it may be irritated for a while, so try not to blow your nose for the next 20 minutes or so. I'm going to give him some Kleenex to kind of wipe it off, but it's kind of gooey and stuff. So try not to get him to blow his nose for the next 20, 30 minutes so he doesn't get a nosebleed. And that is how you remove it. So then you would record that you deceived the NG tube and any kind of checks and placements you've done and assessments, all those. Thank you.